ask them to do the full movement. So you can do a lumbar rotation or flexion, extension and lateral flexion and PSIS. First mark 2 PSIS. In line with PSIS we get S2. The next iliac crest. Iliac crest we get. What do you get? Iliac crest. L4, L5 space. This is floating rib. Floating rib. Floating rib we get L2. Okay, first mark this. Once you get sacrum is a flat one, keep coming up. Then you get a depression like C1. You get a depression that is L5. L5 is a depression. Quite easy to make out here. L4, 3, 2 and 1. You palpate PSIS. We have S2. From there you go down, you get a depression that is L5.
Then L4.
You hold like this then. You try to hold in this position. You can't be a model. You hold here, this is 4, 3, 2 and 1. You should be able to make out here. You can palpate both the borders of the spinous process. You can hold both the borders of the spinous process, superior border and inferior border. First, again, PSIS, iliac crest, floating ribs. Now we are going to palpate the facet. So L1, L2 facet is less than a finger distance. L3, L4 is more than a finger. And when you come to L4, L5, it is 1.5 finger. It comes like a pyramid shape. So once you mark it, once you put a line, then you trace for this facet. It's quite easy to get if you go in gently. Okay, again get your forces from your shoulder and do it. Otherwise, we have this erector spinae muscles over that region. So this is a place where you have to palpate for the facet. So please try to remember L5, it's almost 1.5 fingers or more than that you get. And don't try to palpate the iliac crest because the iliac crest and the facet is getting closer. L3 transverse process. You're 2.5 fingers distance over here. But it's very deeper, it's very painful. That's what we don't do as a treatment technique. But if you want to palpate here, you palpate L3. From there, 2.5 fingers distance, you keep it in this position. Can you feel here? That's a transverse process, but it's tender. So that's what you don't do any treatment over here. If we can palpate the spinous process, if we can palpate the facet joint, it's fine. Because as I told you earlier, there are two techniques which we'll do in lumbar. One is this. You try to see here. The facets. That's the reason why we need to develop this rotation and give a pressure. What is that glide?
Inferior glide. Inferior glide.
Central PA. Central PA. So if I do it on the side, transverse vertebral pressure. So you have central PA, we have transverse vertebral pressure. Hand under the pelvic and you do this rotation. You are not moving here. You are holding it here and keeping it like this and doing this. This is also effective with the back pain. So this is unilateral PA over facet joint. So you have a little bit downward and then yeah. So this is called as this rotation. So if you remember, we did a rotation graded manner. Dropping the leg down.
Yes.
You drop the leg down. Ask him to drop the leg down. As much as possible, you take it in, take it in, take it in. You keep one hand here and hold it like this. You feel tight? Fan tight or? You get tightness in this facet. Okay. Once you get the tightness, you hold it like this. This is the one which is going to do the technique. You keep it like this, keep it like this. Has to be kept on the side of the thenar and hypothenar should be kept on L1 to L5 on the side of the spinous process. On the side of the spinous process, we need to keep thenar and hypothenar. Keep it like this. Okay. So by keeping it like this, I am trying to get this lateral flexion. So you also assist him into getting into this position. Okay. Can you please cross your hand? Good. Once you are getting this lateral flexion, the next concept which we need to do is rotation. So lateral flexion and rotation. All of you close your eyes. So lateral flexion and rotation. Once you get into this position, you hold here and give up. This is called as rotation gliding thrust. This is done for rotation. Okay, so you take if you have a big hand and these are the people on the shoulder. So get into this rotation and then you give a little bit of a thrust. And this is indicated only when they have a facet joint lock. If they don't have a facet joint lock, don't do any of this manipulation, what we studied or what we learned. So these are the two things. One is L4, L5 in sideline position. If you remember, the concept is push